of overweight and obesity, coupled with diet-related non-communicable diseases in adults, is a matter of concern to the Ministry. Lack of balanced diets that provide the body with the essential micronutrients is still common. Superimposed upon infectious diseases such as malaria, the challenge of micronutrient deficiencies is substantial. Almost 25% of our population is anemic. 2 in 5 pregnant women and 1 in 4 preschool children are anemic. Iron deficiency anemia affects cognitive and physical development in children and reduces productivity in adults. The COVID-19 pandemic poses grave risk to the nutritional status and survival of vulnerable groups such as young children, pregnant and lactating women, persons with underlying medical conditions, people living with disabilities, and the aged in the population. Good nutrition is necessary in the care of people infected with COVID-19, as it contributes to enhanced immunity and generally better health outcomes. The Ministry of Health has developed several guidance documents for continuity of essential health services. Among this is the interim guidance for continuity of nutrition service delivery that provides key recommendations to health service providers during this COVID-19 pandemic. Essential nutrition services provided include early detection, referral, and management of acute malnutrition and other nutrition-related disorders. Other services include nutrition counseling, micronutrient supplementation, growth monitoring and promotion, healthy diet promotion, and integrated outreach services in arid and semi-arid counties. Micronutrient supplementation with iron, folic acid for pregnant women, and vitamin A for children under 5 are provided for free in public health facilities. Our performance in this area during this COVID-19 pandemic has been good. In the period January to July 2020, vitamin A supplementation was provided to 87.6% of under 5 children, compared to 67.4% for the period July to December 2019. The county governments are commended for this achievement through the Malezi Bora Integrated Campaign. We continue to encourage all Kenyans in need of health and nutrition services to visit the nearest health facility. According to the Integrated Phase Classification of Acute Malnutrition, released yesterday, 27th August, the nutrition and food security situation in the country is still stable, thanks to the good rainfall performance during the long rainy season. Malnutrition levels, however, still remain unacceptable, especially in the arid counties. Much work needs to be done by the 2 levels of government in this area. Sustainable efforts in tackling malnutrition require a multi-sectoral approach. In this regard, the Ministry is collaborating with the Ministry of Agriculture, Livestock, Fisheries and Cooperative in promoting good nutrition by enhancing access to safe, nutritious and affordable foods through the 1 Million Kitchen Gardens initiative. The Ministry is also collaborating with the Ministry of Labour and Social Protection in integrating nutrition and health education into cash transfer programs with the aim of improving the nutritional status of the beneficiaries. And the government will continue to support investment in treatment of acute malnutrition and mobilize development partners' support in this endeavor. Turning to our COVID-19 statistics, today we report 241 people have tested positive following the testing of 4,520 samples over the last 24 hours. This brings to 33,630 the number of confirmed cases of COVID-19 in the country. And our cumulative tests now stand at 442,713. From these 241 cases, 228 are Kenyans, while 47 are foreigners. 152 are male, 89 are female. The youngest is 1 year old, the oldest is 86 years old. In terms of distribution by counties, Nairobi leads with 113 cases, Mombasa with 14, Taita Taveta 10, Kiambu 10, Kirinyaga 9, Narok 9, Kajiado 8, Laikipia 7, Nakuru 7, Uasin Gishu 6, Turkana 6, Busia 5, Lamu 5, Trans Nzoia 4, Kilifi 4, Kericho 4, Kakamega 4, Kisumu 3, Nyeri, Machakos, Makueni, and Bomet 2 each, Kitui, Bungoma, Embu, Nyandarua, and Nandi 1 each. In Nairobi, the 113 cases come from Westlands 20, Langata 11, Embakasi 10, Starehe 8, Lagoreti North and Kibra 7 cases each, Embakasi North, Kasarani, and Madare 6 cases each, Embakasi Central and Embakasi East 5 cases each, Dagoretti South, Embakasi West, Kamkunji, and Roysambu 4 cases each, Makadara and Ruaraka 3 cases each. Mombasa's 14 cases come from Vita 7, Changamwe 5, and Likoni 2. The 10 cases in Taita Taveta come from Voi 9 and Taveta 1. Kiambu 2 had 10 cases that come from Kiambu Town 3, Ruiru 2, Gatundu South, Kabete, Limuru, Makadara, and Thika 1 case each. The rest of the breakdown is provided in the document that will be shared with you. I'm happy to inform you that we have discharged 66 patients, 40 coming from the home-based care program and 26 from various hospitals. This brings our recoveries now to 19,434. And again, we want to thank our healthcare workers for the good work that has enabled us to achieve these results. I'm also glad today to inform you that we have no reported deaths, and our fatality still stands at 567. Thank you. For once, we can thank you very much. Thank you. But since we have time, I have our nutrition team here. There is something they wanted to share with the nation in terms of self-assessment, mothers assessing their children for malnutrition. I think you can give them a few minutes just to demonstrate what they do and how mothers should be able to take measurements very easily of children and be able to know whether their children are malnourished or not, and then to take them to health facilities. So you can demonstrate very quickly what you want to do.
Okay.
You have a chance today because we have no questions.
Okay. Thank you, CAS. Members of the press, what we have here, as the CAS has mentioned, that we are still having a challenge of acute malnutrition among children. And we are also aware that due to COVID pandemic, there was a reduction in the number of children who are attending the child welfare clinics. For this reason, we want to empower the mothers to be able to monitor the nutrition status of their young children to avoid them getting into acute malnutrition when they are at home. So we have come with a very simple tip. It's called the mid-upper circumference measuring tape, where mothers will be empowered by the community health volunteers. They can take the measurements of their children under 5 years, and as you can see, it has the traffic color code: red, yellow, and green. So once the mother measures the mid-upper arm of the child and it indicates red, it means that the child is suffering from severe acute malnutrition, and the action the mother needs to take is to go immediately to the health facility. When the color, if the color is yellow, it means that the child is suffering from moderate acute malnutrition, and the recommendation or the action the mother needs to take is to continue feeding the child with nutritious food and keep monitoring. And if it continues being yellow and tipping to red, she needs to go to the health facility. The other one is green. The green one, it means that the child, in terms of nutrition status, it's normal. And therefore, what the mother needs to do is to continue feeding the child the way she has been doing, and ensuring that the baby or the children are getting nutritious food. So we are calling it the family MUAC or the mama MUAC. And it is empowering mothers to take charge of their children, of the growth of their children, so that they are able to early detect cases of malnutrition and take appropriate action.
Thank you. You should introduce yourself and say who you are, so they know.
Okay, thank you. I'm Veronica Kirogo, and I'm the head of Nutrition and Dietetics Division in the Ministry of Health. Okay. And with me, this is how Mr. Muraga will be able to show you how it is done. It is very easy for the mothers. Maybe you can come.
Okay, this is how the MUAC is usually allowed the mid-upper of the child, and then it is put here, then here, then here. And again, you should not make it so tight or too loose. So when it is here at red, that is when now you say that the child has severe acute malnutrition. When it is at yellow, the child is suffering from moderate acute malnutrition. And when it is green, the child is well nourished and required to continue feeding on nutritious food. Yeah, thank you.
Thank you. You can share this information with the media.
Yeah.
Okay,
Thank
you very much.